Hi, I'm Bruce Bailey, CEO of Georgetown Hospital System. Your health and well-being are important to everyone on your healthcare team. We hear and read a lot about medication errors, which are the most common type of medical errors that occur inside or outside a hospital. South Carolina hospitals and doctors are working hard to reduce medication errors, but we need your help. You can help us take better care of you by giving your healthcare team important information about yourself. Ask questions about your medications and treatment plans to make sure you understand what you need to do to get better. Follow your doctor's instructions and keep accurate, up-to-date records of your medications. Be sure to update that record as your doctors make changes. All of this sounds pretty overwhelming, but there's a very simple tool that can help you keep track of your medications. This tool will help you take your medications exactly as your physician has ordered and will make it easy to share accurate information with those caring for you.
I'm Jerry Harmon. I'm a doctor that would prescribe medications to help our patients. And the medicines generally do a very good job of helping. Occasionally it's hard to remember what you're taking, and sometimes you can take medications that might have interactions and have potential problems. What we've designed as a healthcare industry is a form to help us remember these medications. It's called the Universal Medication Form. It was developed by a pharmacist in Anderson, South Carolina, to help one remember these. You can write the name, the dosage, and the times of your medications on it, and you can keep it with you. You can fold it up, you can put it in a wallet card or purse card, keep it within your pocket with other important information. When you go to a doctor or you go to a hospital, take this medicine with you, take this prescription form of this listing with you, and share it with that doctor or that healthcare provider, and let them know what your medicines happen to be. And if you ever get in a situation where you have an emergency, it's really difficult then to remember what's going on, have this available. Share it with the emergency medical technicians should it be a necessary thing to do, and they can save your life potentially with this medication form. It's critical, it's important, and we encourage you to use it. Thanks.
Hello, my name is Pat White, and I developed the Universal Medication Form several years ago, and I really would like to tell you my story about that. I'm a caregiver, the primary caregiver for my Aunt Nora. She's in her 80s and she takes 12 medications each day. Over a period of about 4 years, she had several surgeries and procedures. She had a heart cath with stents, she had total hip replacement, and she also had cataract surgery. Every time she would go to the doctor's office or to any healthcare setting, they would ask her the same question: which medications do you take? And it is just so hard for a person to remember all those medications on the spot, and she could not remember all 12 of her meds. So when we got home one day, I asked her just to get all of her medications out, and we sat at the kitchen table and we took a legal pad and we just listed all the medications one by one. And we included all the directions, and we even included her allergy information because we knew that was important also. One day she had a bleeding episode and we had to rush to the emergency department. And one of the first questions they ask is, which medications do you take? Well, it was a very stressful situation and she could not remember all of her meds. And even though I've been a pharmacist for over 30 years, I couldn't remember all of her meds either. Then I remembered, oh, we have a list in her purse. So we dumped everything out of her purse, found the list, and gave it to the nurse. The nurse was so pleased to have the complete information. Detailed information like this can be so vital and life-saving as the physicians decide which medications need to be stopped or adjusted. So the following week, when I got back to work, I thought this would be a good idea to turn into an official form. So I did that, and then I shared the form with facilities throughout the state, and the form was very well received. After that, several organizations, healthcare organizations in the state, endorsed the use of the form. They felt like it was a great tool for people to use to keep track of their medications because it literally keeps everybody on the same page. So I encourage you to complete a universal medication form for yourself and to encourage your family members to do the same. And especially if you're a caregiver, complete a form for your patient and keep the form updated. It can save valuable time and it can even save lives.
Mrs. Doe, I'm so glad you're feeling better.
Thank you.
I'm sure you know by now your doctor has written discharge orders so that you can go home. Aren't you ready?
Yes, ma'am.
Good. Well, I do have a little bit of work to do, some paperwork. to get the process rolling. But in the meantime, if you wouldn't mind going ahead and calling your family so that they can come and pick you up.
All right,
Okay?
I can do that.
And also, while I'm gone, look at your medications that you'll have to take when you go home, and our pharmacist will come in shortly and he'll review these medications with you. Okay?
All right.
Be certain to ask any questions that you have, especially to him, because he's our pharmacist. He'll be best to answer that for you.
All right.
Okay?
Okay.
All right, I'll see you in a little bit.
All right. Thank you, Ms. Davis.
Good morning.
Good morning.
Ms. Doe?
Yes.
Hi, I'm Greg Nobles, one of the pharmacists at the
Nice to
hospital.
meet
How are
you.
you doing? Good. I hear you're well enough to go home.
Yes, sir.
Good. I stopped by to go over a list of your medications that you're to continue after you leave the hospital and a couple of tools that we've developed to make sure you're safe, not only in the facility, but as you leave, okay? One of the first is this brochure that we developed. What you need to know about your medications, it's medication safety tips, both in the hospital and how to manage medication at home, also your physician's office. For example, anytime you get a new prescription from a physician, please make sure you ask what it's used for, that you understand what it's being used for. And how to manage your medications at a pharmacy. Please make sure when you pick up even new prescriptions or any refills that they look just like they did before. If not, if all else fails, don't ever hesitate to speak up and ask. Okay? The other document we have is a universal medication form we've prepared. It's got your personal information, your immunization records that you often have to recall, any allergies you may have to medications, and we've prepared a list of medications that you're to continue after you leave the hospital. Now, by medications, I mean any prescription medications, any samples, any eye drops, ear drops, any herbal medications, any over-the-counter products. Even if it's only for a couple of days, this needs to be a running list of your medications that you're actively on today. If any of these are discontinued, please draw a line through them because they've been discontinued. If you get any new ones, write them down at the bottom as well. We've got instructions on how to use the form on the back of this as well. Okay?
Can I use this on my home computer?
Absolutely. This tells you a website that you can download this. You can have a copy on your home computer for every family member if you like. But the most important piece is to make sure that it keeps updated and they have the copy with them at all times. Another thing we've prepared for your safety is to make sure you have this form when you need it, is this little plastic pocket protector. You can see I keep mine with my driver's license and insurance card as well, so that you have it at all times. So, because this can ensure your safety, but the most important piece is to make sure you keep it updated daily, you keep it with you on your person at all times, and to share it with every healthcare worker. But above all else, if ever in doubt and you have any questions, don't hesitate to speak up. Okay?
All right.
All right, thank you.
Well, thank you.
Safe trip home.
Bye now.
Bye-bye.
It's important that we all work together to prevent medication mistakes, and you, the patient, need to be an active partner in that effort. After all, only you know what medications you are actually taking at any given time. Be sure that your healthcare providers are on the same page. The Universal Medication Form, along with the brochure, What You Need to Know About Your Medications, can help you reduce the likelihood of your taking the wrong medication or dosage of your medicine. And please, if you ever have any questions, don't be afraid. Speak up. Ask your nurse, your physician, or your pharmacist any questions that you have about your medications. Let them know of the concerns you have. Ask them for help in completing or updating your Universal Medication Form and keep it with you at all times. Working together, we will reduce the number of medication errors in South Carolina. Thank you.